The new health care law still has Democrats and Republicans fighting in Washington. But here at home, a La Crosse woman has been battling for her own care. News Channel 8's Cynthia Schweiger joins us live in the studio to tell us why she hopes health care reform puts an end to the struggle for help. Cynthia?
Well, Mark, after fighting and losing the war with insurance companies for coverage, a La Crosse woman is hoping the new health care laws will keep other people who have pre-existing conditions from going through the frustration and financial stress that she's been through. At just 22 years old, Amber Cordes has fought a chronic disease, is missing body parts, and is hundreds of thousands of dollars in debt because insurance companies won't cover her. But you'd never know.
It sounds crazy, but I am pretty lucky.
Just a few years ago, this spunky young woman went through the scare of her life.
I started noticing when I would go to the bathroom, I started losing a lot of blood, and I didn't really know what that was about. After just the blood, then I started noticing severe pain anytime I ate.
She was in and out of the emergency room and on a lot of medication. After 4 months, doctors finally figured out Cordes has ulcerative colitis, meaning her colon was lined with ulcers. It got so bad she had to drop out of school, which also meant being dropped from her mom's insurance.
Everything's out of pocket, so I had thousands of dollars just building up and building up. To the point where I had to think to myself, okay, well, if I have a flare-up, try and do everything you can not to take yourself to the hospital if you can possibly help it, just because I knew there was a price to pay if that was the case.
Cordes went through 3 surgeries. Doctors had to take out her colon and her rectum, tacking on more money to her growing bills.
I got sent to collections, and they threatened to start garnishing my wages because I couldn't pay. They wanted at least 10% of my medical bill every month, and I just can't do it. I don't make enough money, and I would tell them that, and I don't expect pity from them. I just, want them to understand I'm sending you what I can.
Cordes was turned down from St. Clair's Mission because she was making too much money, and Badger Care also denied her coverage. She says when she called, a representative told her she'd have a better shot at getting help if she quit her job.
I can't just not do my job just to get help, and I just have to accept the fact that I'll probably have these bills for the rest of my life.
But now, with health care reform passed, Cordes and her mother hope others will get the help they never had.
I just hope that no one has to go through the frustrations that I have had to go through or anybody else has had to go through trying to find help. The next generation won't even have to worry about that. They'll just, if they get sick, they get help.
Now, because Cordes no longer has her colon, her fight with ulcerative colitis is over, and she's hoping her fight with insurance companies comes to an end as well.
All right, Cynthia, you mentioned health care reform in this bill that's just passed. How is this bill directly going to affect her?
Well, she has a pre-existing condition, and in the past that's denied her coverage. But now insurance companies are able to accept those people, and so she'll be able to have that coverage that she didn't have.
The pre-existing conditions, not everyone's happy about that, however?
No, not everyone is happy about health care reform passing. Some people are worried it will actually jack up the price of overall health care coverage, and they think that might increase the price of premiums as well.
All right, Cynthia, thank you for that story. Because of the new health care laws, more than a dozen states are now filing lawsuits against the government, saying that it's unconstitutional to require everyone to buy health insurance.